a mouth breather and why this even matters. And so, when I'm talking about mouth breathing, I really want you to think about what your baby's mouth does when they're sleeping and when they're just at rest. So, when they're awake, but they're not babbling, they're not eating, they're not at the breast, they're not crying. I want you to think about what your baby's mouth is doing. Is your baby's mouth open a lot, a little? Do they have their tongue sticking out all the time? I really want you to start watching your baby, because if their mouth is even just a little bit open when they are at rest or when they're sleeping, this means that they are breathing through their mouth and not through their nose, which is really how we want to be breathing in order to really get all of the proper oxygenation into our body and also clean the air as it comes into our body. That gets done through the nasal cavity. And so mouth breathing is a red flag, especially if you have a baby who maybe is waking up frequently at night, maybe is really fussing and cranking a lot, seems to be overtired. Um, but also, mouth breathing is something that you need to be looking at just to rule out. The other thing is snoring. So, babies that snore, I know it's cute, but it's not okay. It's a red flag also that there's something going on with their airway, as is that mouth breathing, most likely. So the thing is that mouth breathing can increase some of the bacteria that comes into our body because it's not, again, going through that filtration system of the nose. It can also lead to things like generalized fatigue, anxiety, difficulty concentrating, especially for our slightly older children and us adults as well. And when you're breathing through your mouth, you're also more likely to be breathing up high in your chest instead of down low using your diaphragm and your belly, right? And so when you're breathing up high in your chest, you're actually activating more of that sympathetic nervous system, which is sort of that fight or flight stress system. And so this can, of course, have implications on our mood, our sleep, and just overall mental health as well. And so I want to talk a little bit about what some of the causes of mouth breathing are. So, of course, there's going to be tongue function. Okay. So, if our tongue is on resting on the floor of our mouth instead of up at the top palate. So, ideal resting posture when we're sleeping or we're awake and at rest is actually with our tongue up to the roof and lips closed. So our tongue is suctioned up and our lips are closed. That is the optimal resting posture. So, if your baby is mouth breathing, that means that most likely their tongue is actually resting on the bottom of their mouth. And that could be due to a variety of different things. That could be due to body tightness that's keeping that tongue down. So the tongue is actually made up of 8 muscles. There could be tightness in those muscles, but also in all of the attachments and the fascia that's coming down from the body. So often babies that have torticollis or various different head shape discrepancies like plagiocephaly or brachycephaly, sometimes there is body tightness going on as well. And sometimes that can keep the tongue down in a low resting tongue posture, which keeps the mouth open and means that your baby is breathing through the mouth. Sometimes the tongue can also be kept down by tethered oral tissue. So if there is a too tight or too short or too thick frenum or frenulum, that little piece under the tongue, if that is too far forward, if it's too short, if it's too thick, if it's too tight and it's keeping that tongue down, then that tongue is not able to get up to the palate to provide that suction and then have the lips closed for that optimal resting posture. So that's another reason that your baby might be mouth breathing. If there is enlarged tonsils or enlarged adenoids, that also might be causing difficulty with airway. And as a result, then that mouth breathing as well. If there's lots of nasal congestion going on, maybe due to food allergies or intolerances, that your baby is potentially having some sensitivities to something in your breast milk or something in the formula, that can often cause lots of mucus production in the back of our throat and in our nose. And if we have lots of congestion and we can't breathe through our nose, then we're going to be breathing through our mouth, which then just increases all of that inflammation because, again, that air is not getting cleaned and filtered through the nose like it's meant to be. So those are a few of the causes of mouth breathing. So I want to talk a little bit about how can you tell besides looking at your child and watching what they're doing with their mouth? But another sign of mouth breathing, definitely, I mentioned snoring. But also grinding teeth can be a sign that there is also an airway issue, and they're actually grinding their teeth to like wake themselves up. So, for example, in the case of like sleep apnea, where babies, young children, adults, everyone kind of stops breathing for a few seconds throughout the night. And so that grinding of the teeth is often seen. Yes, it could be due to stress and anxiety, but oftentimes, if that's happening at night, it's often seen as a way for them to kind of wake themselves up. Um, and then also, if you're waking up with a very dry mouth, and then I think I mentioned the snoring as well. So, and then obviously just watching your baby's mouth if it's hanging open. What are some of the risks of mouth breathing in young children? So, here's the thing. Of course, if the mouth breathing is happening because of airway issues, or even because of those tethered oral tissues, or some kind of tightness and the tongue is not moving the way it should be moving, if that tongue is not able to get to the palate, you're also going to have feeding difficulties. So, feeding and extracting the milk from the breast, but also feeding difficulties from a bottle and being able to manage that milk, being able to swallow that milk. So, you might have lots of gagging, coughing, kind of sputtering and trying to get away. Maybe there's failure to thrive because your baby is not actually able to get all of that milk out. Maybe you have low milk supply and you don't know why. It could be that your baby is not efficiently draining the breast. So that might be part of the reason of what's going on. So feeding is a huge piece of the puzzle, right? So if your baby is not using their tongue properly, if they're breathing through their mouth, then there could also be feeding issues, which can also lead to sleeping issues. So sleeping issues, if they are having, mouth breathing and they're having difficulty sleeping because of that, they're not getting the good oxygenation. They're not falling into that really nice deep sleep, that restorative sleep. But then later on, also, it can lead to difficulties in the jaws. So, they often the top and the lower jaws become underdeveloped because that tongue is actually what grows and develops our palate. If that palate stays high and narrow, then our mouth is not growing out the way it should be. And so they become underdeveloped, which can then negatively affect all of the structures. So, face, nose, even the size of our airway. It can also affect tooth development, whether there's teeth like crowding of the teeth. It can affect gag reflex. There's just so many things. Inflamed gums, of course, behavior if you're not sleeping well, allergies also because everything is not getting properly cleaned as it comes in, right? And so there's more increase in allergies, which then further negatively impacts airway, right? And so these are just a few things that can develop even later on. And I'm talking about this right now because I've just started going down the rabbit hole of mouth breathing and tongue ties and airway issues because we are on that journey with my 4.5 and 6.5 year old. My 6.5 year old just had a sleep study done. He has mild sleep apnea. He has mildly enlarged adenoids. We're now going into this whole journey of let's talk about palate expansion for him. Like it's a whole journey because he's got underdeveloped upper jaw, lower jaw. His teeth are coming in. His adult teeth are now coming in. There's not going to be enough room for all of them. So we're really having to get all of this stuff done now. And in hindsight, yeah, actually, he has a tongue tie too, but that's like the least of his concerns these days. So, like, I wish I had known 6 years ago that I should be looking for these things inside the mouth because I could have potentially prevented a lot of these other issues from happening. Um, so we're really working on getting him to mouth breathe. We're doing some myofunctional therapy to get that tongue moving again. And we're really working on mouth breathing. And I got my kids both these little stickers that kind of go around the mouth. And so they wear them at night and it just offers some pressure on the lips to just almost like unconsciously cue those lips to close. So it's called myotape, and we are loving it. My son is the sensitive one, so he's still working on wearing it for the entire night. My daughter is able to wear it for the entire night, and I swear she is sleeping better. She's no longer sleeping with her mouth open for as much as I can tell. And I have not heard her grinding her teeth in a while. So I'm really excited for this sort of progress that we're making, even just with something as simple as it's like kinesio tape, basically, that they're just putting around their mouth. And they can still sip water, they can still breathe through their mouth that they needed, but it just offers a little bit of pressure to kind of like signal to the proprioceptors in our body that like, oh, keep those closed, and then that gives the feedback to your brain of like, okay, lips closed, right? And then the tongue up. So it's all very, very cool. So that's definitely something that you could potentially try. But I highly recommend that if you have a baby who is mouth breathing, that you are going to get a full oral functional assessment done. So either an IBCLC who has training, additional training in tethered oral tissues, so tongue ties, lip ties, cheek ties, a pediatric dentist who has that additional training and who's also airway centric or airway focused, a speech language pathologist or an occupational therapist who have additional training in tethered oral tissues and that oral function. Because the reason I'm saying additional training is this is not taught in the sort of core curriculum of occupational therapy school or speech and language therapy school, or even in IBCLC programs. It's not one of the core things that is taught. Even in dentistry, it's not. So that's where you would potentially look into also ENT. You really want to make sure, though, that you've kind of ruled out these other like tethered oral tissues and tongue function, body tightness, body work with a craniosacral therapist or an osteopath, sometimes even a pediatric chiro, depending on their sort of mode of approach. So all of those can really, really help to relieve some of that body tightness that might also then be presenting in the tongue. That might then keep the mouth open. So that is why you should be watching to see if your baby is a mouth breather and why it matters, and also how to get help. One of the last things I want to share with you today is if you do have a baby who is a mouth breather, when they are sleeping, if they're sleeping with a pacifier, I would pop that out when they're sleeping, and I would actually, right under here, right behind the bone, there's a squishy part. And you're going to just push that squishy part up until their lips close, and you can almost kind of feel that suction of the tongue. And that's called the sleeping tongue posture hold. It's easiest to do when they're sleeping. So if you've just fed them and they fell asleep in your lap, you can check to make sure that their mouth is closed. If it's not, you can do that sleeping tongue posture hold. A quick Google search will also show you how to do that specifically on babies. And how you can check to make sure that tongue is up is you would just gently pull down their chin, and eventually you'll see that tongue fall down. And that means that that tongue did get up to the top. If it didn't, you'll open that, you'll pull the chin down, and that tongue will just be low. So that is a quick little tip for you to try and test out with your babies. I really want to hear whether you're testing your babies, whether you are checking your babies, whether they have mouth breathing, and whether you maybe have noticed it now with this video. I would love to hear that all in the comments below. If you want more information like this, please feel free to come and join me inside my sleep deprived mama group. Holistic and heart-centered support without sleep training. Again, the link is all under along with this video. And I will see you guys again soon.